Hello viewers, in today's video we will talk about the ulnar nerve. In previous videos I have talked about the brachial plexus, I have talked about the cutaneous sensation of the upper limb, and I have also talked about in detail about the median nerve. In today's video we will talk about the ulnar nerve. Now if you remember my brachial plexus video, you would know that ulnar nerve is one of the important peripheral branches of the brachial plexus along with the radial nerve, median nerve and musculocutaneous nerve. Ulnar nerve forms part of the big four peripheral neural branches of the brachial plexus. So ulnar nerve is formed from the medial cord of the brachial plexus. There are three cords in the brachial plexus, and relative to their position with respect to the axillary artery, they are lateral cord, posterior cord and medial cord. Medial cord, as you can see in the picture in the top right hand corner, it is formed by the union of the C8 and T1 spinal nerve roots. So the root value of ulnar nerve is usually C8 and T1, although in some individuals C7 also has a contribution to the formation of ulnar nerve. But largely speaking, C8 and T1 is the root value of ulnar nerve. Just like median nerve, ulnar nerve also does not give out any branches in the axilla and the arm of the upper limb. So upper limb has the arm from the shoulder joint to the elbow joint. From the elbow joint to the wrist is the forearm, and from the wrist to the tip of the fingers is the hand. So ulnar nerve forms in the axilla, does not give any branches in the axilla, goes posterior or behind the medial epicondyle in the elbow joint and passes through the cubital tunnel. Again, no branches in the arm, no branches in the axilla from the ulnar nerve. Once it enters the forearm, that is the antebrachium, the ulnar nerve supplies the muscles in the ulnar aspect of the hand. Now, which muscle is in the ulnar aspect of the hand? It is that muscle which contains the word ulnar in its name, flexor carpi ulnaris. So, motor supply or muscular supply to the flexor carpi ulnaris is provided by the ulnar nerve, and also the ulnar half or the medial half of the flexor digitorum profundus muscle is supplied by the ulnar nerve. The radial half or the lateral half of flexor digitorum profundus is supplied by the median nerve. So two muscles in the forearm are supplied by the ulnar nerve, whole of the flexor carpi ulnaris muscle and the ulnar half or the medial half of flexor digitorum profundus muscle. Now ulnar nerve, if you want to remember one thing about it, it is the nerve of the hand. It is also known as the musician's nerve because it controls many of the intrinsic movements of the hand. And ulnar nerve enters the hand through a canal called the Guyon's canal. You can pronounce it any way you want. G-U-Y-A-N. Some people spell it as G-U-Y-O-N also. So Guyon's canal. It enters the hand through the Guyon's canal, which is in the medial aspect of the hand, that is towards the midline, largely over the pisiform bone. Now once it enters the hand, ulnar nerve of course provides cutaneous sensations, as it has been shown in the picture on the right. The upper picture shows the anterior aspect of the front of the hand, the palmar aspect, and the lower picture shows the dorsal aspect of the back of the hand. So the ulnar half of the hand, ulnar side of the hand is supplied by the ulnar nerve. This is the skin sensation. The entire little finger or digiti minimi is supplied by the ulnar nerve, both motor supply as well as sensory supply, and the ulnar half or the medial half, the ulnar half or the medial half of the ring finger is also supplied by the ulnar nerve. So that's the cutaneous supply which we have talked about in my video on cutaneous sensations of the upper limb. Now let's go into the motor supply. Ulnar nerve is responsible for providing motor supply to many muscles in the hand, starting with all the muscles of the hypothenar eminence, that is the abductor digiti minimi, the opponens digiti minimi and the flexor digiti minimi. There is the palmaris brevis muscle, there are the lumbricals, not all lumbricals. First and second lumbricals are supplied by median nerve, third and fourth lumbricals are supplied by ulnar nerve. Third and fourth lumbricals are in digits 4 and 5. It's very important to remember the lumbricals 1 and 2 are in digits 2 and 3, and lumbricals 3 and 4 are in digits 4 and 5. That is the ring finger and the little finger. Now, ulnar nerve also provides motor supply to the dorsal interossei and the palmar interossei. The palmar interossei are responsible for adduction, that is pad, and the dorsal interossei is responsible for abduction of the fingers. So, abduction of fingers, abduction is dorsal interossei and adduction is palmar interossei. Easy to remember is pad and dab. And another muscle that people tend to forget is adductor pollicis. Adductor pollicis is also supplied by the ulnar nerve. So, ulnar nerve provides motor supply to adductor pollicis muscle as well. So, this is the video on ulnar nerve. Let's move on to the radial nerve in our next video. I hope you liked this video. Take care and bye bye.